Hello, hi guys. I'm sorry I got late. Some issue with the connection. Hello everyone, hi. Hi. Okay, I think we start. So, hi everyone, I'm Aditi and I'm the founder of NewMe, India's first end-to-end product and services platform that focuses on women's health from puberty to menopause. Today we will be discussing all about IVF and we have with us Dr. Gaayatri Juneja. Dr. Gaayatri Juneja is a senior consultant obstetrician and gynecologist at Ayoni Cure and CK Birla Hospital. Dr. Juneja has over 20 years of experience in the field and is a member of Royal College of Obstetricians and Gynecologists in the UK, as well as the Delhi Medical Council and Indian Medical Association. So today we will be asking her some important questions with regards to conception and IVF. So let me add her to the chat. Hello, Dr. Gaayatri.
Hi Aditi, thanks for having me today.
How are you?
I'm good. How are you? Thank you so much.
Very well. Thank you for being here. I think IVF as a topic, I think people know about it, but there are lots of questions around it that people are not aware of. So it's great to have you here to discuss all of that.
Pleasure's all mine.
So starting with the first question, what is IVF?
Okay, so IVF is a kind of artificial reproductive technique where nothing is artificial about it. We use the own sperm and the patient's own eggs, fertilize it outside the body, and place once the pregnancy starts growing. That's the in nutshell.
Okay, okay. And so what what are typically the steps to the procedure?
So first of all, it is who is the right candidate. That
Right,
candidate selection is there.
right,
उसके बाद हमारा मेन ये होता है कि why we are going for IVF.
right.
The indication for IVF success rate depends on the indication per se. Okay. So the steps to IVF is the doctor will first run few tests for you, know
Okay.
exactly how many egg reserves are there because females are born with a limited quota of eggs. It's
Mm.
like a bank balance. We are born
Okay.
with few lakh eggs. As we become teenagers, our quota runs into few thousands. By the time we start reproducing, that quota further depletes and it comes into few hundreds only.
Okay.
If the doctor would like to see कि आपका egg reserve, the bank balance कितना है,
How much is?
how
Okay.
much is it, then what are your body hormone levels? There are few hormones called FSH, LH, and other hormones which are responsible for egg production and pregnancy.
Okay.
कहाँ कमी है क्या है उसको they run a few tests including husband semen test,
Right.
ultrasound. Then उसके बाद they will give you to suppress your own hormones. बाहर से injections देते हैं. The whole procedure will take, actual procedure is around 3 weeks,
Okay.
but entire thing takes around 2 to 4 months to diagnose and to suppress your own hormones and stimulate the egg production from outside. Once they feel the egg is started forming, they will take out few eggs from your the ovary. That is done in slight sedation, not a very painful procedure.
Okay.
Same day the patient gets discharged. Then they take the husband's sperms, they cultivate it, make the pregnancy happen in a petri dish. It's a glass dish kind of a thing, and a very highly sterilized environment with certain. They try to mimic it as natural as possible.
Right.
Then they quantify what is the quality of the embryo's form. So embryo is something like once a pregnancy happens, the egg and sperm, they combine. That is when they call a embryo. थर्ड एंड फोर्थ डे पे जाके वो उसको आपके वूम में ट्रांसप्लांट कर देते हैं.
All right.
So
Okay.
this is in little bit of nutshell.
Okay. And when should a couple consider going for IVF?
See, these days, what is happening is all of us are very career conscious, and marriages are taking place late. Plus, there are so many malignancies happening.
Right.
कई family histories होती हैं, तो there is a certain category who want to start the family late. तो वो क्या करते हैं अपने, because the egg gets depleted, they go and preserve their eggs. फिर बाद
Right.
में then there's another category जहाँ पे tubes are damaged because for pregnancy to take place, a sperm has to travel through the womb cavity, through the tube, till the ovary, the pregnancy starts, then the entire embryo comes back. So अगर tubes the रास्ता बंद होगा तो आप
How will
जाओगे.
it happen? Right.
How will it? So if the tubes are damaged, or there's certain conditions called endometriosis.
Right.
Endometriosis is becoming very common nowadays, and उसमें भी tubes damage हो जाती हैं, and it's a very painful period. So many things are there. और अगर suppose करो husband का sperm is nil,
Right.
and through medicines also you are not able to get it. In
Hmm.
that case, there is something called ICSI. It's a modified part of IVF. उसमें husband
What
का
is
ही
it called? Sorry.
ICSI, ICSI,
Okay.
in cytoplasmic sperm inoculation. So
Okay.
उस क्या करते हैं, वो sperm testis से baby sperm लेके उसको grow करते हैं.
All
That
right.
is bit, but it's a part of IVF only.
All right.
Then suppose आप कई बार होता है कि सब कुछ ठीक है, there's something called unexplained infertility. आपने natural try कर लिया, आपने IUI is like when you take husband's sperm, semen, prepare it and place it inside the womb. वो भी नहीं, 4-5 cycle हो गए, नहीं हुआ, then that is called unexplained infertility, and then we go for IVF.
All right. And are there any side effects of the procedure?
The side effects में since we are giving artificial hormones, तो mood swings आ सकते हैं, थोड़ा bloating हो सकता है. There is something called ovarian hyperstimulation. Although we try to give from minimum to maximum dose, but at times body reacts कि एकदम से वो बहुत सारे eggs बन जाते हैं, तो that is called ovarian hyperstimulation.
Okay.
In that case, वही पेट दर्द होना, bloating, vomiting, ये सारी problems आ सकती हैं, which your IVF specialist will definitely look into, and वो follow up में पकड़ में आ जाता है. Then जब हम egg pick करते हैं, उस time we जो है through the vagina we try to aspirate the eggs. उस टाइम जो नीडल से कई बार इंजरी हो सकती है. इट्स अ वेरी रेयर चांस, बट यस इट कैन हैपन. इट कैन पंक्चर अ ब्लड वेसल और मे बी intestines or bladder or something. It's a rare possibility, but it is a
Possible.
possibility, yes.
Yeah. Okay.
Then once pregnancy takes place, the chances of miscarriage is not very high, but slightly higher than a natural.
Regular. Okay.
The reason being कि हम जब डालते हैं तो we try to put not more than 2 embryos.
Right.
So that क्योंकि multiple pregnancy के chances बहुत ज़्यादा हो जाते हैं. Multiple pregnancy has its own complications.
Right.
तो वो कुछ problems हैं pregnancy related which are specific, जो ज़्यादा हो जाती हैं, जैसे high blood pressure हो गया.
Right.
तो ये थोड़ी बहुत complications हैं, nothing which cannot be managed. Not to be scared of, but your doctor will definitely keep an eye on.
Right. And so typically you said that it takes 2 to 4 weeks, you said the process
3
takes.
weeks roughly.
3 weeks
The
roughly.
entire.
And
So we
usually
try-
how many?
Yeah.
Sorry,
tell me.
you can go ahead, please.
No, we try to mimic the natural process, how our body behaves. So 2 weeks it takes for the egg to happen. Some, if it's a 30-day cycle, roughly 14-15 day ovulation होता है, तो उसी को मिमिक करते हैं हम लोग.
Right.
First second day से we try to stimulate egg production, aspirated mid cycle pregnancy करके, तो वो, लेकिन आपके हार्मोन सप्रेस करने में पहले एक साइकिल पहले स्टार्ट हो जाएगा, तो इसीलिए वो थोड़ा एक्सटेंड हो जाता है.
And usually, how many times do couples try? Like, how many times does it happen to finally? It does. Is it like in one go somebody can conceive, or does it take longer than that? The
So
trial.
if we see natural pregnancy, if you compare natural pregnancy versus IUI, that is taking the semen and placing, so natural conception mein it's around 11% that a pregnancy might happen, 11 to 12% roughly.
Okay.
And in IUI thoda better ho jata hai, say 15-16%. And in a very good center with IVF, the success rate is around 35 to 40%.
Oh wow, that's amazing.
And आजकल तो techniques have become so good that people are conceiving even in first cycle.
Oh wow. But that must also depend on at what stage, as you said, how much the female has in her, bank, the amount of
Oh.
eggs that she has. That yeah. So yeah, okay. And how should a couple prepare themselves for IVF? What is it that they should be doing before the IVF? Any particular tests or anything that they need to know?
So by the time a couple reaches an IVF center, वो इतने धक्के खा चुका होता है that they
Right.
are like mentally exhausted.
Drained. Yeah.
Definitely. It takes a toll on their mental health.
Right.
Physically भी, because everyone has tried कि ये दवाई शायद लग जाए या वो लग जाए, इतने डॉक्टर्स के चक्कर काट लिए. तो first thing is look after your mental and physical health.
Right.
Be reassured कि होगा, have patience and trust your doctor. Give time
Right.
to your doctor.
That's a very important point.
So mental preparation is more. Baki, of course, it's an expensive procedure, not to say, because the medical medicine etc. are very expensive.
Right.
बाकी को अपने health issues पे workout करिए. You should be fit physically.
Right.
You are in ideal condition के pregnancy आपकी body उसको carry कर पाए.
Right. And I think that usually this suggests that they should not be smoking or drinking.
Yeah,
Is
that's
that
true. The
that's
healthy lifestyle, healthy lifestyle.
healthy lifestyle? Okay.
I'll tell you one thing very interesting. In lockdown, there were many IVF cycles which got cancelled and patient conceived on their own. The reason being, घर पे थे, काम का स्ट्रेस नहीं था, डर के मारे हेल्दी लाइफस्टाइल जी, and it worked wonders. So
Right.
IVF नहीं पड़ी.
Right. I think that for a lot of couples, mostly when they go to a doctor always tell them, don't take stress about this. The more you take stress, the more difficult it will be. So as you said very correctly, that they have to focus on their mental health first, and then go ahead, because it does take a toll. And that was my next question, that I mean, how mentally it takes a toll on the person. So I think that talking to somebody, like taking a couple coaching or something, would help,
Yeah.
right?
Counseling has become a part of IVF treatment. So
Right.
of the good centers, they have counselors who make them relax, teach them
Yeah.
learning, all those meditation. It really helps.
It really helps. Okay.
Yeah.
And so, are there any alternative to IVF? Any maybe like
IVF,
natural treatments or something that people can try before trying IVF?
naturally, is you're trying naturally, it's a timed intercourse. You should know what are the fertile days. Don't get,
Right.
keep on lying down. If it doesn't work, maybe after a year or so, then you should, I mean, you should wait for a year at least before you go to doctors to take medicines for conception. Then after this thing, natural conception has failed, maybe you're not ovulating properly, maybe you're
Right.
having PCOS. In
Right.
that case, they will give you medicines for egg formation and then ask you to try naturally. If that doesn't work, then they will do IUI, where they'll take a partner's semen, uh, they process it and they place it inside your womb and wait for pregnancy to happen. But usually we don't do it more than 5 to 6 cycles because we don't want the eggs going waste. If it is
Right.
not happening in 3, 5, 6 cycles, then IUI is not going to work. Then is the time that you should actually go for IVF.
IVF. All right.
Yeah, and the best age is before 40 because after 40 your eggs are actually depleting a lot.
But if you
The
have already frozen your eggs, then after 40 it's possible?
yeah, it's possible even in 60s. People are
Okay.
doing, they're taking donor eggs and doing it.
Lovely. I didn't know that. Wow. And so could there be any complications associated with IVF? Once a couple of things you told us, but if there are any more complications that can come up.
So, there was a controversy recently, but it's not been proved that breast cancers and other things, there's no actual association with it, but there was somewhere a controversy had come, but it has been uh, suppressed. Now it's not possible to have breast cancers or ovarian cancers due to these treatments. So, apart from that, it's a reversible, whatever side effects you're having, it's all reversible.
Okay.
After some time, it's quite safe. Nothing to worry.
Okay.
Because the question many people have asked me. This is why I'm bringing up this topic.
Right. Right. Okay, so I'm done with most of my questions. I knew there were a lot of questions that people wanted to ask. So, guys, please, if you can ask your questions right now, we'll just wait for one or two questions to come up.
So I'll just tell a few of the things my patients they come and ask me.
Sure.
One thing they say is हमें अपना बच्चा चाहिए.
Right.
इन the बच्चा आपका ही होता है. उसमें
Exactly.
नहीं है कि just because you've gone for IVF, you are just they keep on trying again and again without realizing they are wasting time. If it is not happening, it's not happening. And IVF
Right.
से बच्चा आपका ही है. Then there is one important thing. Suppose किसी parent में जैसे father का husband में ही problem है, genetic है, which can get passed on. So we can get a donor semen and do an IVF if
Right.
IUI is working.
Right. Right.
So they have to understand that there's nothing. That's why I said it's called artificial reproductive technique, but there's nothing artificial about it.
Artificial about it. Right.
Your own body is producing all those things.
Right. I think we do have some questions. Is surrogacy a better option?
See, till 3 years back, surrogacy was quite rampant in India. But then we realized the foreigners they were coming and बच्चे कर रहे थे and they were abandoning the babies and going. So the government has come up with new rules where surrogacy, commercial surrogacy is totally banned.
Oh,
And
okay.
अगर आपको surrogacy, basically what is surrogacy? Surrogacy is when your egg and the sperm is of the partners, you're using a womb
Yeah.
to carry it.
Right.
The surrogate has to be married. अपना उसका बच्चा होना चाहिए जो आपके rules है, and she should be related to you.
Oh,
You see, it's very difficult to get through surrogacy, so IVF is best option.
and why is it that they have to be married? Like, I just need to understand.
Don't ask me that because
there's there's no logic to that, right? I mean, they don't
नहीं
really.
लॉजिक का ये है कि बेसिकली आई थिंक मे बी दे वांट टू सी के पेशेंट बंदा जो सरोगेट मदर
She
है
has someone.
क्योर्ड और व्हाटएवर, मतलब अपना बच्चा है तो वो सरोगेट वाला बच्चा दे देगी. शी विल नॉट फाइट फॉर इट कि अब मेरा बच्चा हो गया. मे बी फ्यू
Okay,
लीगल आई डोंट नो. दिस इज
fine.
बेसिकली टू सेव एवरीवन.
Right, understood. Understood. What is the age limit for IVF?
There is, like I said, 60s में भी हुआ है,
Yeah.
but best age group is around 26 to 50 in a female. and up to 55 in a male. Although male can produce sperms and even in 80s, 90s also. But physical fitness is most important. Age का ऐसा नहीं है. If you be able to carry the baby or not, that is equally important.
Right. So how is, I think we've already taken this, but how is surrogacy different from IVF and which is a better option?
Surrogacy जब होएगी नहीं तो option ही रह गया एक.
Any.
It's so difficult.
Could any complications arise from IVF procedure? We've already taken this question. IVF pregnancy, baby have any complications?
See, they are like any other pregnancy, first thing. Second thing, like I said, कि अगर किसी पे हमें है कि शायद pregnancy फादर किसी पेरेंट में कोई प्रॉब्लम है तो there's something called pre-implantation diagnostics.
Okay.
तो वो में सेल लेके एम्ब्रियो में से दे रन टेस्ट इन इट कि बच्चे में कोई प्रॉब्लम तो नहीं आएगी. Otherwise, if there's no such history, so we follow the pregnancy like a normal pregnancy only. जो रूटीन शेड्यूल अल्ट्रासाउंड है ब्लड टेस्ट है वो सारे वैसे ही चलते हैं.
And but you said that there could be chances of multiple pregnancies, like so. In that case, what complications can come for
So
babies?
first of all, we are not putting more than 2 embryos.
Right.
Twins has its own problems in the sense that one baby can grow big, one can remain small.
Right.
Depends कि वो there are two babies in two sacks or two babies in one sack. जो two babies in one sack होते हैं identical होते हैं. So उनकी अपनी अलग complications होती हैं. Maybe one baby is drawing more food, the other one is not growing that much. Then there is a risk of prematurity that is there. High blood pressure problem, diabetes. There are many pregnancy related problems. Nothing exceptional.
Yeah,
जो
nothing
एक
essential.
pregnancy में हो सकता है वो सब हो सकता है.
Right. Okay. What is the success rate of IVF?
So in India, most of the good centers they're having 35 to 40% success rate, which is at par with abroad. In fact,
Amazing.
they are better.
Yay. Okay. Aditi is asking, is there a way to only have one child via IVF and avoid multiple pregnancies?
So they realized when they used to put 3, 4 eggs and they used to all start growing. So there was something called selective fetal reduction, where they used to kill the babies inside. उससे क्या होता था when they used to put something called KCL injection in the fetus's heart to stop beating it, तो उससे कई बार दूसरे डैमेज हो जाते थे. तो इस वक्त 2 से ज्यादा वो डालते ही नहीं है. Because at times what happens, only one takes up, other automatically अपने आप ही खत्म हो जाता है. तो to safer side, so we have something called rating of the embryos. Prefer to put 1, 3A, triple A, that's the best quality. A का थोड़ा सा कम डाल देते हैं कि अगर उसने ग्रो कर गया तो अच्छा. There's nothing wrong with the baby. ग्रो कर जाए तो अच्छा, नहीं तो एक तो कर ही जाएगा.
Understood. Okay. Anything else anybody wants to know? Please, if you can write your questions. No, I think we are done with the live. So, I mean, lots of things that I also didn't know about IVF you told us today, especially that. Okay, we have a question. How common is ovarian hyperstimulation syndrome? How common is it?
10 to 15%.
10 to 15%. That's, I mean, is that high? I think it's a little
It is significant.
significant, yeah.
But it's quite, see, it depends what is exactly you're looking at. There is mild, moderate, severe ovarian hyperstimulation. So mild is okay, acceptable. Moderate is manageable. Severe is something we don't let that happen. That is a rare thing. But mild to moderate हो सकता है, but that's quite manageable. We need not cancel the cycles in that.
Okay. Priyam is asking, are there any natural alternatives? We've already taken this question. Yeah, okay. I think we've covered most of it. Priyam, we'll be saving this live, so if you've missed on anything, you can listen to it again and you will have the answer to your questions. Um, yeah, okay. I think we are done, Dr. Gayatri.
Yeah, if
And
anybody wants to ask anything on later also,
PCOS affects pregnancy.
yes, it does. I mean, in the sense, it is difficult to conceive, but it
Right.
does not affect pregnancy per se. It's
Yeah.
slightly difficult for the hormones to act. Depends on if it's a lean PCS or a thick. It's a patient is obese or lean. So doesn't matter. PCOS is one of not the only indication for IVF.
Right. So guys, thank you so much for joining today's live, and thank you, Dr. Gayatri, for answering all the questions. If anybody has any doubts regarding this, you can please feel free to message us on Newme. And yeah, I think we are done. Thank you so much, Dr. Gayatri. Thank you for joining us today. Thank you.
Bye. Good night.
Bye. Good night.